Hello everyone, this is Dr. Tanya. I'm a high-risk pregnancy consultant. Today I'll be talking about a very interesting topic, that is arginine versus citrulline, which is superior. Arginine and citrulline, we know they both are amino acids, though you may not have seen citrulline in the amino acid list, but still they both are amino acids. So before jumping on to discuss these two molecules, let us first revise biochemistry a little bit. So what are amino acids? We all know amino acids are the building blocks of proteins. So amino acids, when many amino acids they combine, they form long chain, and that is how a protein molecule is formed. So basically, when we are talking about proteins, that means we are talking about amino acids. So how important are proteins in our body? Starting from the antibodies to cytokines to digestive enzymes like amylase to transport proteins like hemoglobin, or to the structural proteins like keratin, collagen, elastin, or the proteins in the muscles like actin, myosin, or the transport proteins like ferritin. All are proteins in the body. So proteins are that very important. So basically there are 300 amino acids, roughly 300 amino acids occurring in nature. Of these amino acids, few are proteinogenic amino acids and few are non-proteinogenic amino acids. So what's the basic difference between the proteinogenic and the non-proteinogenic amino acids? Proteinogenic amino acids are the ones in which amino acids are incorporated in the protein structure. That means those particular amino acids, they are incorporated, they are there in the structure of a protein. So those are the proteinogenic amino acids. Non-proteinogenic amino acids are the ones which are not present in the protein structure, but otherwise they are present in the body because they are very crucial for the biological functions of the body. Now, arginine is a proteinogenic amino acids, whereas citrulline is a non-proteinogenic amino acids. This is the reason why you have never seen citrulline in the amino acid list. Now, usually when we talk about amino acids, we generally talk about the proteinogenic amino acids, which are 22 in number. Earlier they were 20, and two of late they have been added. The 21st one is the selenocysteine, and the 22nd one is the pyrolysine, and we don't need both of them, so we'll not talk about them. We'll only concentrate on the other 20 amino acids. Of these 20 amino acids, 11 amino acids were earlier classified as non-essential amino acids, and 9 are the essential amino acids. 9 essential amino acids means these are the amino acids which the body will not produce. You have to take it from the external source, be it your diet or the supplements. Now, non-essential amino acids are the ones which the body will produce. And of late, from these non-essential amino acids, a newer classification has come wherein they have given a third category, that is semi-essential amino acids. Now, what are these semi-essential amino acids? Semi-essential amino acids are the ones which the body is also producing, but when the need increases, the body is not able to meet the demands. And these are that means you have to take it from the external source. And in this semi-essential amino acids, arginine tops the list. That is the reason we are giving arginine from outside in pregnancy, because in pregnancy the metabolic rate is increased, the metabolic demand is increased. So arginine has to be supplemented from outside, because it has to go to the fetus, and for the growth of the fetus, and obviously for other reasons as well, arginine is required. So arginine we are giving every day to almost all the patients, especially in cases of preeclampsia, especially in cases of IUGR, we're giving to the patients. So what arginine does in the body? Arginine is the immediate precursor of nitric oxide, and nitric oxide is required for vasodilatation. Starting from the early pregnancy, where placental development is taking place, for vascular growth, for embryonic growth, till the end of the pregnancy, we need nitric oxide so that proper vasodilatation is there, and all the nutrients from the mother through the placental bed, they can go to the fetus, and obviously for maintaining the normal blood pressure also. So this is how arginine is working in the body. Whereas what is the role of citrulline? Citrulline is the immediate precursor of arginine. That means if I want vasodilatation in the body, so citrulline will be converted into arginine, arginine will be converted into nitric oxide, and nitric oxide will produce vasodilatation. So to get vasodilatation, citrulline is required. Now, what is the problem with arginine? The problem with arginine is that arginine has a very low bioavailability. That means whatever arginine you are giving from outside, 40% of this arginine will be destroyed in the liver and the GI tract. That means it will undergo GI and hepatic extraction, and only 60% will reach the body for what it is given. It will fulfill those functions for what it is given. Okay, so only 60% will be there, so 40% will be destroyed. So the bioavailability is too less. Then whereas on the other hand, for the citrulline, the bioavailability is very high. Why? Because citrulline, it bypasses it bypasses the splanchnic bed. It does not hardly any degradation of citrulline takes place, and whatever citrulline you are taking from outside, though we are not taking, and diet is a very poor source of citrulline, but still if you take citrulline, so 100% will go, hardly any degradation will take place, so that increases the bioavailability of citrulline. And secondly, the half-life of arginine is very less when you compare it with citrulline. The citrulline half-life is quite high. Citrulline is again a very strong antioxidant. It is again required for the synthesis of many other proteins. Then it is a very important component in the urea cycle. The more citrulline you have, the more ammonia will be thrown out of the body. So citrulline is again, so it's that very important. But the major drawback with citrulline is that diet is a very poor source of citrulline. There are hardly any dietary sources of citrulline. Whatever citrulline we have, it is there in the body, it's produced in the body, and that's why it's there only it is utilized. So diet is a very poor source of citrulline. So arginine, if we are giving 3 grams sachet of arginine, that means 1.2 grams is being already destroyed, and only 1.8 grams is fulfilling the functions for which it is given. So citrulline, so many studies have been done. So many studies have already been done wherein they have seen citrulline, the positive results of citrulline. It's done in mice. It's done in humans also. In 2023, like 2 studies have come up wherein L-citrulline has been used in preeclampsia, in pre-eclamptic women. Giving very positive results. And still, so many studies are going on where they are seeing the results of citrulline. So citrulline is a very promising molecule, but till the studies are being going on. Till then, let us focus on the dietary sources of citrulline. The basic and the most important dietary source, or the richest dietary source of citrulline, is none other than watermelon. Yes, you heard that right. It is watermelon. Watermelon, there are 3 basic varieties. One is the yellow watermelon, then the orange, and the red one. The red one is the one which we consume. So the highest is in the yellow watermelon. So we'll not talk about the yellow and the orange watermelons, which are not available freely in India. So we'll just talk about the red watermelon. The flesh as well as the rind both contain citrulline, and even if out of all the 3, even if the red one has the least amount of citrulline, but still it has a very high amount of citrulline. The flesh, we'll talk about the flesh only. So the flesh of a red watermelon has per gram has 1 milligram of citrulline. That means if you are taking 100 grams of the flesh of the red watermelon, that means you are getting 100 milligrams of citrulline. So the content is that very high. So till then, let's depend upon a watermelon. You can give in many patients of IUGR, you can give in many patients of preeclampsia, given the patients wherever you feel feasible. And we can avoid in diabetics, wherever you can avoid, wherever you want to avoid, you can avoid, but otherwise you can rely on watermelon. Also for citrulline, it's the richest source, the richest dietary source of citrulline. So let's consume watermelons, and let's our patients benefit, because watermelon is not new to our body, it's not new to us, it's a very pocket friendly fruit. So we can have watermelon for citrulline. Thank you very much.